Welcome back, everyone, to another episode of Your Mouth Matters, the podcast where we dive deep into the connection between oral health and overall wellness. I'm Dr. Rebecca Taylor, and today we have an incredible guest joining us, Dr. Stephen Lin, functional dentist and author of The Dental Diet. Dr. Lin has been at the forefront of bridging the gap between nutrition and dentistry, showing how the foods we eat play a crucial role in our dental and facial development, airway health, and even systemic wellness. If you've ever wondered why so many people today need braces, why mouth breathing is such a big problem, or how diet can prevent dental disease beyond just cavities, this episode is for you. Dr. Lin's work is a game changer in the way we think about oral health. We'll be diving into his research, the role of fat-soluble vitamins in jaw development, how breathing and oral posture affect facial growth, and practical steps you can do to improve your oral health and nutrition. I'm so excited for this conversation. Let's dive in. Welcome, Dr. Lin. How are you?
I'm well, Dr. Taylor. Thank you so much for having me. We were just talking about how summer's just ending over here and you guys are just going into the end of winter.
I know. It's been a little rough. I mean, we're in the Pacific Northwest. I feel like we've been super lucky, but this summer it's been pretty sunny. But yeah, it's just pouring rain today. So anyways, thanks for your time. I'm super excited about this conversation. This is one of my all-time favorite topics, which is nutrition. Actually, before I became a dentist, I wanted to do something with food. I've always just been like obsessed with cooking and nutrition. And so when I went into dentistry, I was like, well, okay, I don't get to do much with food, but hey, here I am. I found it back again. So
yeah, there's this funny link between teeth and food that, we don't really generally think of, but it's an amazing link once you kind of connect the dots.
Yeah, totally. I mean, I would love to hear about what your journey is. So like, can you tell us a little bit about how why did you write the dental diet? How did you get to where you are now?
Yeah, it was a funny story, actually. I did dentistry postgraduate after studying biomedical science degree. And then I kind of just got through dental school. Dental school's hard, right? So you're kind of really busy and then you probably don't really have time to think about, or maybe I didn't. Some people knew they were specializing or knew they were doing something or other, with themselves after their degree. But I was kind of like getting through and I was like, I wasn't really sure where my career was going to actually lead. And so I went out into practice and I was like, first 2 years of dental practice is really hard as well. You're upskilling really quickly and like you're doing things that you learned in dental school, but you hadn't had a lot of experience in. And then so once I kind of got through those kind of periods, I was starting to kind of get to this stage where I was like, I wasn't really sure if I was, kind of felt, kind of that real satisfaction out of my job, that I felt I was patching up a lot of kind of problems and like didn't have a lot of answers to, maybe why I was doing it. And that didn't really kind of, that didn't actually happen in my head. I wasn't asking why at that stage. I just had this feeling that something wasn't quite there. And then going away, once I went backpacking to kind of just get away from it all to see if my thoughts gathered on what I really wanted to do, or where dentistry was actually taking me. And I was in a traveling hostel in Turkey, and I came across a book called Nutrition and Physical Degeneration, just randomly on the shelf. Picked it up. It was actually by a dentist. Never heard of it. In 7 years of tertiary study, I'd never been told about this book, and it was written and published by a dentist in the 30s, and then basically it had been republished in the 90s by a foundation. And so I picked up the book, didn't really read it, but had a lot of pictures in it, which I thought was interesting. So I threw it in my bag and kind of forgot about it for a bit. Went back to practicing, and eventually there was this pull towards like what that book was telling me, and I picked it back up. And I was looking at basically, a lot of the questions that, say, parents were asking as to why does one child need braces, or in most cases, both children need braces, but the cases were different, or one child had tooth decay, one didn't. And then I was finding that our modern textbooks weren't really answering what this kind of, a lot of these questions were asking. And then so it led me to kind of think a little bit, starting to dig a bit deeper into things thought-wise. And then I actually picked up the book and I found that it was Dr. Weston A, and he was answering that very question. So he had that very question back in the 1930s, and he went around the world to, say, 12 cultures all around the world, and he was looking at the intersection between the modern diet and where people ate traditionally for many generations. And he found the dental disease that we see today, 30% of tooth decay, and the rates of malocclusion all pop up in one generation of eating that modern diet. And so that was kind of a big thing for me. And that took a long time to drop, and especially the idea that diet causes malocclusion, or that malocclusion is a condition that's driven by the lack of nutrients. Like, that's something that I'd never heard of and that we never really had spoken about in dental school. And that kind of led me into the kind of rabbit hole of, hey, trying to understand this whole thing, that, well, actually malocclusion and so forth is a condition of where we're not developing properly, where the craniofacial system doesn't develop in the right way. And it actually is diet driven. And we were just talking before about like what kids eat when they're young, and how having young kids, there are certain in a certain way that we do that really does affect their craniofacial growth. And so I think it's such an important point for parents to know. And it was all written in that book. And so once I started to kind of understand that, I began to put it all together in terms of, hey, this is what this guy said, this is what we see now, and this is what the modern research says. And there's a whole world of developmental myofunctional dentistry out there that I then discovered afterwards that show how the muscle systems develop with jaw, and how the tongue and breathing and the factors that actually help a child's jaw to grow and develop optimally. And then so we then basically, you can kind of put those two things together, like the muscular and the malleability of the jaw, and then the nutritional drivers, and then that becomes a whole picture of how we grow, a full set of 32 adult teeth, hopefully without the need for braces or orthodontic intervention. Yeah, but there's a kind of a story in between that. But that was basically how I discovered the whole set of information.
That's amazing. I mean, the fact that they never talk to you in dental school about nutrition, at least in my experience. They're just like, don't eat sugar, and
that's nutrition.
That is, but there's not really much beyond that. And then, it's also like pushing the fluoride a lot, like, oh, supplement with fluoride if they don't have it in their water. So they talk about that, like, oh, they might need a supplement, but never talking about like the fat-soluble vitamins, how important those are, how important that nutrition is. And, there's just so few dentists that even really talk about it. even today, our dental students aren't getting, I don't think, much training on nutrition. So the fact that you picked up that Weston Price book, that with his research, like, that's pretty, that's some divine intervention right there.
It felt like it was, when I initially picked up the book, I didn't have a clue, right? You don't, like, yeah. You're absolutely right in that the dental schools don't talk about this stuff at all. So you've got no idea, like, your brain is, like, not wired at all to think about how jaw develops. It just doesn't. Like, we learn to label malocclusion to class 1, class 2, class 3, but there's no thought of why it's happening. And there's no kind of, it's a big step for your mind to take.
It's so foreign. When you start to kind of go down that rabbit hole and go, oh my gosh, like, maybe, wow, like, this actually makes sense. And you start to go down that nutrition or that functional medicine, rabbit hole, like, we got to treat the cause, not just the symptoms. It goes pretty deep. But that's awesome that you were like open-minded enough to read it and not throw it out and say, like, this is garbage. I think a lot of dentists would,
Yeah, well, that was my first. I thought, oh, it must be disproven, like, if this is here and I haven't learned about it in my degree.
Yeah,
it
must not be true.
Yeah, right. Yeah, and that's the initial thing. And, like, I did have that skepticism, which is probably why I didn't read it at first. But, to kind of give listeners the perspective on that, that's what our kind of modern field is that, our view is right, and that there's no kind of, there's no reasoning around questioning that at all, which isn't scientific when you really think about it. However, in defense of kind of dentistry and dental education, it's like, sugar and the harms of sugar is actually much more well known now, probably in the last decade. And dentists have been onto that, and dental education has been onto that for, decades now, saying how bad sugar is. And however, that in terms of the medical, the medical, issues associated with sugar consumption really is quite recent. So in, dentists and dental education's defense, I think we've been kind of onto the sugar stuff pretty well, but it is superficial in the
I like
sense that,
that. I like
yeah,
that. Yeah.
right.
No, I agree with you. I mean,
Well,
even the medical profession, I mean, I watched a bunch of documentaries and stuff, and they still, I mean, the sugar industry is still pushing that, like, fat is the problem, it's the fat, it's not the sugar. And you're like, oh my gosh, really? No
yeah.
way. I mean, there's good fats and there's bad fats, right? But like, they still want to blame everything on fat and like the low fat stuff that's got more sugar in it to compensate for the flavor. It's just, yeah.
Especially in America. America is very still driven. I mean, it's still like that in most places, to be honest. But like the low fat, I remember I did 6 months of study in America, in Miami in 2004, and the whole kind of the zero fat, the dairy stuff, and it was at the time actually Atkins was kind of around, so there was a little bit of the kind of low carb stuff being talked about. But I didn't know anything about it at the time. But yeah, it was very driven
Yeah.
towards low fat. And the reality is as well is that there's no real nutritional. There's some schools that outside of traditional teaching that talk about fat-soluble vitamin nutrition yet. So that's still to be worked into the medical system. So has to happen, hopefully.
Yeah. So, okay, so you read this book and then you were like, I need to write my own book. Like, I need to get the word out to the public
What?
and the community, or like what I mean, I feel like writing a book is just so much work and you have to be so inspired. So, like what how did you come up with I need to write a book and I'm going to tell the world about this?
Yeah, it was the process that I kind of went through. I was like flicking through this thing, and I was like, he'd got all those old photos, and I was like, well, this is a lot to kind of intake. But then what I was doing is I was starting to kind of amass a list of his conjectures and his kind of theories and so forth, and looking into what has kind of clarified them since. And what I found was that there was a heap of research that showed exactly what he was talking about. And that was vitamin D research. Probably primarily that was the one that really kind of opened my mind. Vitamin D research is something also that we don't get a lot of exposure to in dental school. But really, I started to learn a bit about what we knew about vitamin D in modern terms. And it's like, oh, actually, it wasn't until about 2000 that we started to actually really have meaningful studies where we started to realize, all the things that it did. And then a lot of the studies that showed, how we can understand it, even with dental disease as well, which probably another 10 years later that showed that vitamin D was associated with lower risks of dental disease and even some intervention studies as well. So small amount, but there. So then I started to realize, oh, hang on, there's a whole set of research here that clarifies what he's talking about. Not quite exactly. The big one, though, when I realized that the connection between the vitamin K2, and so what Price was writing about is he wrote about vitamin D and vitamin A. Vitamin A you can talk about as well because that's still not very well understood. But vitamin D, there's a whole bunch of research. Vitamin A, he was postulating that worked with vitamin D. And then there was a third nutrient that he said worked in trilogy with these three, which was what he called activator X. Now, the story kind of came out, the book got lost for 70 years. Price's work was thrown out a little bit. He was actually the head of the American Dental Association research, but
I
his
didn't know
work
that.
was, yeah, he was a big figure at the time.
Wow.
However, his work was thrown out, I think a little bit because his work on root canals, like he went quite hard against root canals and saying that they all been extracted, and they eventually threw out his book and his work in the 40s, and it got lost for 7 years. And it wasn't until the people that started the Weston A Price Foundation in the 90s picked it, or 80s or 90s picked it up, and they started to read it. And there was a researcher called Chris Masterjohn that actually read his work, and then he connected in the link between activator X and a nutrient that they were studying in both Eastern Europe and Japan called vitamin K2. And that was a super interesting story. Now, vitamin K2 is a synergy nutrient with vitamin D. It picks up all of the calcium and helps vitamin D. So vitamin D absorbs it. Vitamin K2 allows it to be used into the body. And we still don't acknowledge it in Western medicine. However, in Japan, actually we're maybe just starting to now, but to acknowledge vitamin K2. However, in Japan, they acknowledge it as an osteoporosis treatment. And they show a study showing that they test it against studies that have vitamin D with and without K2, and they show that the bone density in the studies of the people who take the K2 on top is better. So that kind of showed me, hey, there's actually a big scientific story here that is a missing piece of medicine, a huge missing piece of medicine that actually shows that vitamin D on its own isn't as effective or isn't really effective. And there was a 2011 study that a lot of physicians and a lot of medical institutions used to say, hey, vitamin D is not effective for bone density. And what that shows is that women taking vitamin D supplements and calcium increase their risk of coronary events due to, well, they didn't say what due to, but they said that vitamin D and calcium is ineffective for increasing bone density. So they didn't have an increase in bone density, that had a significant increase in coronary events, and that meant that we needed to stop the vitamin D supplementation because of the risk of coronary event. Now, the problem with that is that when you give vitamin D on its own with calcium and you don't give K2, the body absorbs calcium, but it doesn't utilize the calcium the way it should. It goes into the arteries, and then you get this calcification that is the main driver of the coronary event that they're talking about. So what that study really should be looking at is it needs to be added with K2. And so instead of saying vitamin D isn't effective, they should say without vitamin K2, we shouldn't be taking vitamin D on its own with calcium supplement. So that was kind of a big thing. So, well, everyone is actually being advised away from vitamin D supplements when we should really be advising towards proper supplementation with K2 and A, which is another factor which still hasn't kind of come out as well. Mm-hmm. But that kind of I felt there was enough for a book. I was like, well, we've got vitamin D research, you've got K2, you've got kind of the myofunctional growth and development of the face. So there's a whole story here that Price is working. There's a lot of meat outside of just the kind of what he found and the modern discussion, and to put it all in one place so that dental practitioners, what I felt was the dental practitioners could be using and utilizing this information for their patients. And so that's what led me to write the book. Yeah.
Yeah, that's awesome. I mean, just to have like a resource. I mean, the like you said, the research from Weston Price is like, that's such a big book. The nutritional degeneration book, it's like huge, so just to have something that's like easy to read, a parent can pick it up. I'm curious, have you gotten a lot of dentists like reaching out to you saying, oh my gosh, I want to learn more? Like, how has the dental community received your book?
Yeah, so originally the first thing I was doing was teaching nutritional aspects to dentists. That was what I was first doing in probably 2016, 17. Yeah, there's been a lot of dentists that have reached out, like all around the world. So I taught in Australia, taught in the US, and a little bit in the UK as well. There is a big kind of group of dentists that kind of understand that this, that there's more to what they're kind of looking at, and they're seeing it in their practice every day. Yeah. Everyone's got their own kind of interpretation and their own way of doing it. And so kind of since after I wrote the book, I kind of went back into practice until roughly about halfway through last year, and kind of built out what I thought was the clinical kind of model that all fit within. And, dentists kind of do all their own little bits. But, yeah, there have definitely been, for instance, in 2018, the idea, functional dentistry didn't exist. So that was kind of like the connection was, started to talk about functional dentistry, and then all of a sudden we have functional dentistry and biological dentistry. There was probably back then there was holistic dentistry. That was more of the kind of, and there were dentists that were kind of very onto it. They weren't using things like certain chemicals, or they weren't using certain restoration material types and so forth. But then the kind of functional biological model really only sprouted in the last 3 to 5 years, and that's kind of been a reason because of a lot of things, but then the nutritional kind of underlying, a lot of dentists are interested in understanding it. Yeah.
That's awesome. Yeah, I've definitely seen, like when I first started my practice 11 years ago, I was one of the only, biological dentists, and I was definitely the youngest. I mean, there was a lot of old guys, that were like getting ready to retire, and I was kind of this like next generation and female, but it's been so fun to watch like all these biological dentists kind of sprout up around me, and I've helped mentor several of them, and it's been so fun to just like, we need to get the profession to change, and so like people are always like, well, are you worried? Like you have competition now. And I'm like, honestly, I want the field to change. So it's really, this is how we should be practicing dentistry. We should be talking about nutrition. We should be talking about diet. And if we're all doing that, that becomes kind of standard of care. And that's a reason to celebrate. I just think it's awesome. So that's great. That's great to hear that dentists have been received the info. So, okay. So it's still
reasonably obscure though. Like just to kind of add to that point is that it is still like I still probably more so get written by people looking for people so there's still a lot of work to do. Yeah. In the scheme of things, we still need to change a lot. Yeah.
I think the hard part is as a dentist, like you have the knowledge, but you also have like a limited amount of chair time with patient. And so like a lot of, when I see somebody that has like a lot of cavities, or I have a kid that, somebody that has like periodontal disease or a lot of malocclusion, I send them to my podcast. That's part of why I started a podcast. But I also like, I have like supplement recommendations, but really I feel like in a dental setting, like, we're not nutritionists. We're not functional medicine doctors. So like you need to have your allies so that you can send the patient away, because nutrition is a hard thing. It's people get so, it's like almost religious, it's like a religion. You've got like hardcore vegans and vegetarians, and then you've got people that are like carnivore, and you've got keto people and paleo and, people on the bean diet. There's like all sorts of camps. And so to what I've noticed is in practice, when I say to somebody, hey, like, this is, I think there's a dietary thing here, you got to go into a lot of detail, and it's like, and to sit down and be like, what's your meal plan? What are we going to do? It's a lot of work, So I think having allies, having people you can refer to so that they can go see somebody and they're also on the same page, and that's been challenging for me, because a lot of times as soon as they cross from a dental office into a functional medicine doctor or a naturopath, the naturopaths and functional medicine doctors, most of them don't know anything about dentistry. So when you send them to the naturopath and say, hey, they've got a lot of cavities, go ahead and look into their diet, I've gotten several phone calls that are like, what kind of testing do you want me to do? Like, what do you want me to do? Right? And it's like, well, okay, we gotta work together, right? Because like what Weston Price's research did for me too is it showed me that it's not just about oral health, right? Like we're talking about all sorts of other systemic things too. These nutrients, these like superfoods and these fat-soluble vitamins and these super nutrient-dense diets, they will help you with all of your different things, all of the health things, not just your teeth, right? It's going to help you with osteoporosis and cancers and all of that, right? So it's not just about teeth. And it's like, we need to get other practitioners kind of on board so that we're all speaking the same language, and it would be so great if, I love it when I meet a practitioner who's like, oh yeah, I know about Weston Price. I'm like, oh, love you. I'm going to send to you. Like we're going to be best friends,
It's really hard because like the functional biological dental office is quite advanced in terms of what we're understanding, what we're understanding. And like what I found actually is that those referral patterns don't work very well unless you've got, you're really aware, like you obviously have your referrals where for instance, that they're very onto those kind of things. However, for efficiency, like you said, like the nutrition advice in terms of a dental practitioner, it's not efficient time use of dental practitioner offices of an actual dental practitioner to be doing that, because for a dental practice, you could be making a lot more money off procedures and so forth. And you have to be thinking about that. I found that therapists and hygienists are an excellent tool when you've got them kind of armed and you've got most of the touch points being made with therapists and hygienists. That was a really big game changer, because then they're spending a lot of time, anyway doing their work, and the information just kind of gets worked in that sense. And then you're kind of just shortening everything down. It's like, well, like, can you eat organs? Can you have a desiccated organ stuff? So things are kind of like
Yeah.
condensed. And like, this is healthcare, right? But then the point of that is that if every dental office could be like effective being that kind of middleman, because what you're describing there is like this middleman. It's like you're referring all these patients off to all these practitioners and say what testing. If dental office could kind of kill a lot of the big things, like for instance the main testing things, like I think it's vitamin D deficiency, iron, certain maybe thyroid, or like there's a bunch of things that you kind of get set with the patient, and then have the big kills done. Then a lot of the healthcare issues would kind of nearly crumble away, where you'd see a lot of the chronic diseases, type 2 diabetes, the digestive issues, and maybe even things that are a bit further down the track, like thyroid problems and so forth, that they go and see the GP for start to dissolve. So I really think the functional dental office or the biological dental office could be a way of solving the chronic disease epidemic, because we can solve it all quite quickly, if we do it effectively. And then that means that you're taking the lines away from the general practitioner, and then that all starts to, so the upskilling of the dental office that you're talking about is critical, I think, in the healthcare, fixing our healthcare issues. I think it's one of the main things we have to get right. I don't really see another way to do it, because, we keep criticizing doctors and GPs, but they've got a lot on their plate, and they know so much already. It's like there's they don't need to know nutrition. They don't need, let someone else worry about that. Let a dental hygienist or a therapist, worry about that, and go like do meal plans and nutritionists and so forth. And then let's get them 80% there. Then if they've still got problems, refer them to the GP. I don't know. I feel like a dental office would work much better in that sense if they had a lot of the big problems kind of solved before they came to them.
Yeah, I mean, I've had several patients, like kids especially, that have come in with a lot of decay. We start to talk about nutrition, and we actually do send them to a naturopath, and they do testing. A lot of them have had like celiac disease, or there is something going on. They have like an autoimmune type of condition. And so it's interesting, because when you look at a mouth, if you see decay, if you see periodontal disease, if you see if you see malocclusion, crowded teeth, that's a symptom that there's something off in the body, right? And that's just not a way that we have really thought about it in our society at all. Most people have cavities, right? It's like, if you talk to anybody on the street, very, very likely, probably 90% chance that they're going to have had a filling or had a cavity in their life, right? So it's become kind of normal, but it's abnormal. It's not normal. It means that there's something off, right? So I think part of it too is that we have to look at it with a different lens. That's kind of what you were saying before. Looking at it from a different lens and being more proactive with making recommendations for supplements. I typically will send patients home with like a supplement list, like, hey, these are the different things. These are the things you should be eating. I think implementing it at home can be hard and challenging for some patients, because it's not always like so easy, like when you're like taking away cereal from a kid, and then all of a sudden you're like, you're having bacon and eggs for breakfast and some liver supplements, right? That can be tough, right? Because kids and people get addicted to these carbohydrates and sugars, and they want them, and so it just, so I think that implementing is the hardest part. That's what I've seen for patients, because I can give them your book, I can give them a list of things, but when they go home and they're like, okay, now I need to make dinner, what should I make? That seems to be kind of the toughest part, because it really is a shift in your mindset, and you have to get creative, especially with kids. I have a 2.5-year-old. She used to eat everything. I mean, she would eat literally everything. And now it's like, I can't get her to take a bite of avocado if her life depended on it, So now I had to get creative. I like mash it up, and I put a little chocolate in there, and I put a little liver capsule in there, and I make a little chocolate avocado mousse pudding that has liver. And I feel like, okay, you're eating avocado, haha, like I got you. It's one of my favorite things. Like if I can disguise good food, if I get a toddler to eat it, or like a kid that doesn't like anything to eat it, I'm like so happy. So.
Yeah. And the worst news about that is that as she hits 3, it's going to get harder as she gets.
Oh gosh.
In my experience, I go, like the girls especially get harder. Maybe not all girls, like it's not, but as they get pickier and as they start to see that there's carbohydrates everywhere,
She still comes to me in the morning and says, "Mommy, I need my cod liver oil." So I don't know. She sucks that stuff down. I'm just, one of these days, I know she's going to be like, "Mom, this is gross. This is so gross." I'm just waiting for that day, but it hasn't happened yet. Hasn't happened yet. So, okay. So I know that for a lot of our listeners, like, you're probably listening to this because you want to change your diet, or you want to know, like, how do we change our diet so that we can benefit our total health, but especially our dental health, cavity risk, and prevent our kids from needing crowded teeth. So, Dr. Lynn, can you talk about some of those key principles from your book, so those key nutrients and some of those superfoods that you would recommend that everybody incorporate into their diet?
Yeah, so I might frame it as how I've kind of worked with raising my own kids, in that it's a little bit of a change on what what maybe we've been brought up eating. So I remember what, for instance, what as my sister and I ate as we were growing up, and then kind of little cousins and so forth, is that the cereals and the breads and the carbohydrates and so forth. All of those things amount to simple carbohydrates in the body that do work as substrate for decay, just like sugar. So when you're kind of adding up, how many simple carbohydrates you're eating in a day, especially as children, you are basically adding up their risk for decay. So when kids have, it's not just the sugary drinks and ice creams and chocolates and so forth. It is also the breads and crackers and the pastries and the flour-based pastas, the flour-based carbohydrates that do unfortunately also add to the decay risk. And so when you kind of think of that as a parent, you start to realize that you're in a whole jungle of difficulty. Yeah, the rule is something animal-based, is kind of like meat, eggs, and I'm a big fan of dairy. Not all kids can tolerate dairy, but if you're a parent and you have at least some kind of dairy tolerance, where it's butter or ghee, I would be working in as much dairy as possible. And the reason is because of the fat-soluble vitamins. And so we spoke about vitamin D, and so vitamin D is a fat-soluble vitamin, just like its co-nutrients, vitamin A and vitamin K2. Now, the way the body absorbs this is through fat, and the key point of this is actually the saturated fat, which is the biggest percentage of the type of fat that you eat to absorb these nutrients. So you need to eat a saturated fat in order to absorb. So if you have a vitamin D supplement and you have it with a salad without any kind of real fatty dressing or anything like that, then you're not going to absorb it. It will literally, your body won't be able to. So when you're feeding kids, it's like, well, how do we get these saturated fats in? Well, you cook in fats and you give kids the fatty cuts of meat, and you're planning how they're eating these meats. So in the morning, so bacon's a great one. Bacon cooked in duck fat's a good one, or a butter, or and eggs. So that kind of meal has the the three-pronged benefit of the fat that you're cooking in, which is a butter or a duck fat or something, or a tallow. You've got the bacon, which is high in the B12 and high in nutrients, and you include the fat on the bacon, and the egg yolks included, which has all of the nutrients, fat-soluble vitamins included. So if you can get them to eat 2 to 3 eggs a morning. So I used to eat, when I was eating, probably maybe 2 or 3 eggs a week just for breakfast, but like my kids now, they eat it every morning, and they do get sick of it, and you kind of have to change it up and change it the way you do it, and maybe have a little sauce, and there's all sorts of tricks you have to play on them to get them to keep eating. But that breakfast is a whole game changer on the carbohydrate-driven cereal or toast that they were given. So once you kind of trade that breakfast in, all of a sudden they're getting a good nutrient-based and dense breakfast that isn't kind of fueling the blood sugar spikes that kind of go into the whole risk of, you mentioned celiac disease, which is a really good example for the risk of decay and like the link between deficiencies and the way it kind of expresses in the body as well. And then you're kind of going through the day. So the rules I kind of go through is that, before 3 is that, you've got kind of a window, which is like they'll eat most things. You can control things. After 3, they're starting to go to kind of like, play groups and just, start to get ready for school and everything. Things get a bit difficult. So if you can control those first 3 years, and even, the diet through pregnancy. So if you're planning to have kids, you need to be eating a lot of these nutrients. You need to be, sneaking So the reason why we spoke about organs, Dr. Taylor, is that they're so rich in nutrients. They're the most nutrient-dense food you can have in these fat-soluble vitamins and all the other nutrients that they come with. So that's why sneaking them, and one way to do it is that if you can cook it and your kids will eat it, great. My kids wouldn't eat liver, so I had to kind of sneak it in. Yeah, so we kind of powder it and like you put it and you cook it in with, like you sneak it in with kind of mince, or you can kind of maybe 20 to 30% change it with normal mince to kind of have that mix and things like that, so a couple of times a week if you can. And so they're kind of some strategies where you're working and you're changing the kids' diet to be nutrient dense instead of carbohydrate based, which is the decay driver. And so they're the big tops that I kind of go. I went with the rule with as much dairy as possible, and my kids didn't have issues with that. However, not all kids are like that. But one way I think that helped is that you introduce them with a ferment. So like introduce them with the kefir to start with, help them build the lactobacillus species in their gut. Then they seem to be able, like dairy doesn't bother them, like if they're kind of introduced to that early. But some kids can have intolerances and stuff that you've got to be a bit careful about.
Yeah, and kefir is so easy to make too. Like I make it at home and it's so easy. Everybody should make it. It's super, super easy. The other thing that Weston Price talked about in his research was that if you're going to do grains and you're going to do more of those carbohydrate things, that they need to be soaked, they need to be sprouted, you need to, process your grains and help break those grains down because those are harder to digest. So Weston Price actually wasn't like surprisingly, he wasn't actually like anti-grain. He did find several communities that were eating grains, but they did process them in a different way. And so if you're going to do oatmeal, like with my daughter, like once, a couple times a month, we'll do oatmeal because, she had it at somebody's house and it was so good. And she got now asking for oatmeal. And I'm like, oh my gosh, I don't want to make you oatmeal, but okay. But if I'm going to make her oatmeal, I'm going to ferment it on the counter. We're going to soak it for at least 24 hours with some yogurt and some water. We're going to let it sit. And then you cook that up, add a liver capsule in there, add a bunch of butter or ghee. There's your amazing oatmeal. So you can still, if you do need to do some grains just to kind of bridge that gap, you still can do that, but you also can sneak some things in there and get creative. At least that's what I found.
Yeah, no, totally. And the whole grain thing is we tried to go no grains, just for the, it's just for the kind of those early periods where you kind of you're in a little bit more control. But then, kids are their target is on this kind of stuff. So knowing how to treat them like that is a really important point, so that you can at least have them having grains that are better for the digestion and that you don't have that kind of sugar rush that most of our modern grains do have.
Yeah. So I think to me, the most important nutrients are getting those fat-soluble vitamins in. I know for Quinn, my daughter, I was giving her cod liver oil. That's going to have your vitamin A and your vitamin D. We didn't talk much about vitamin A, but I agree with you. I think vitamin A is so misunderstood, and I feel like so many people are scared of it. When I was pregnant, they told me, don't eat liver. Liver is bad. Yep. If you eat liver, it's going to be toxic to your baby and you could harm your baby. And I was like, really? Okay, go eat my liver over here when you're not watching, just because I know that vitamin A is so, so important. So, but yeah, cod liver oil, that's a great thing to add in. Cod liver oil does not taste great. So I think starting it early is good. You can also mix stuff, we'll mix a little maple syrup in there to try to make it, taste a little bit better, and then chase it with water. I actually did a TikTok on how to take cod liver oil so you don't taste it. So if you have tried and it's disgusting to you, then or it's on Instagram. Yeah, anyway, it's on my page. And then the other thing is butter. My daughter will come down and sometimes at breakfast, she'll just be like, Mommy, I want butter. And I'll be like, okay, do you want butter or do you want ghee? And she'll be like, I want both of them. And I'm like, okay. So I will just put a jar of ghee and the butter in front of her and she'll take her spoon and eat it. And I know that my nanny must think I'm nuts because my kid is over here just eating all this butter. But I'm like, well, that's her K2, she's getting her good fat-soluble vitamins in. So I wouldn't be afraid of butter. I think a lot of people are afraid of fat and afraid of butter, and I would say just let that go. That's kind of old thinking, and, your kid's probably not going to have a weight issue because they ate butter when they were a kid. The other thing I wanted to mention that you talked about is like by age 3, it's really hard. It's harder to get them to eat the things that you want, so you have to get more creative. But it's really interesting because I feel like I don't know, my child's only 2.5, so she's not 3 yet. But I have definitely noticed she's gotten more picky with age. But I feel like if you start to make that eating just kind of normal, like when you start your day with protein and you start your day with these things, like when they're presented with a cookie or a cake or something, like I've seen my daughter take one bite of a birthday cake and be like, I don't want any more of that, because she's just not used to that flavor and that texture, So I'm sure that's going to change over time. But I think that during these early ages, there's so much brain development happening. And, most of our facial development is happening by the age of 8. And most of it really happens before age 5. So if you can, for 3 years, get in these super, super nutrient-dense foods, you're already halfway to like most of the growth and development that's happened in the face. So I think that's why it's so, so, so important that you do this when they're young. And of course, a lot of people don't do this when they're young and they didn't know about this when they were pregnant. And so now they've got a child that's got, issues, and it's never too late. I don't think that it's ever too late to change your diet and see really positive changes. But if you can get that in when they're developing and growing and they're in those like that critical growth phase, I think that is awesome, because I really think that's going to set them up for like much better systemic health even as they're older, as an older person.
Absolutely, yeah, that's really important. And the changing at any point is such a big one too, because obviously, people coming into the practice and so forth and finding that their kid does have an issue, and it's obviously very stressful for parents to kind of figure this stuff out after the fact when you do have a 4, 5, 6, 7-year-old and say, oh, hang on. We've got issues now. And then going through that change process, which you mentioned before, is quite difficult, for busy parents to kind of go through and change, a child's picky eating habits and then shift to a more nutrient-dense process is hard, because it's hard for them both to kind of go through, the time factor and the culture change in the house, but then actually get the kid to actually eat that as well is difficult. So you kind of got to say, back parents up and say, look, it's a process and we've just got to take the wins where we can. It's never going to be 100%. My kids aren't 100%, anymore. We try and control as much as we can when they're, in those early periods. But at birthday parties, they used to be like, oh, we're not interested. Then I can see, especially the girls are really scheming. They're trying to get out of my view and trying to scheme how they're going to get cake out without me.
I feel like you can't demonize it too much. Like, I always feel like if you eat like 90% like really well and you're getting all those like super nutrient things, then have a piece of cake, like it's not the end of the world. Now, don't have one every day, but I feel like it is so hard in our society to get away from these treats. I mean, my niece, her school, they reward kids when they get a question right with a piece of candy. The teachers are giving it out. It's insane. You just can't get away from it, And then what are you going to do? Be like, give that candy to me, we do Halloween here, right? And we do the Switch Witch, where they bring all their candy, they put it in a bowl, they put it outside, and then the Switch Witch comes and switches it for either better quality, always chocolate, or a toy, or money for the older kids. Now the older kids are like, I just want money. But there's just so much candy all the time in these kids' lives. I mean, it's like Valentine's Day, and then it's St. Patrick's Day, and then it's Easter. And, it just keeps going on and on. The candy, the amount of candy that these kids bring home from school is insane. So I feel like, there are some places where you can really have some controls. And then sometimes, you don't want your kid to be the weird kid at the birthday party who can't have any cake, So it's such a balance, being a parent and knowing where do you really tighten up and where do you get a little bit more loose? I have 2 stepkids and they're both dairy intolerant, and also one of them is chicken egg intolerant. So and gluten intolerant. So I've had to learn how to cook gluten-free, dairy-free, and egg-free, which has been very challenging to try to figure out, okay, how do we get all these nutrients in And it's been tough, like we go to birthday parties and we can't have anything. So it's just, it's tough as a parent to navigate today. And I don't think anybody can be perfect, but you are the parent. So, you can also make the rules.
Yeah, that's right. And the foundations and principles, if you put that in throughout the house and like with yourself as well, like kids will notice what you eat and they'll pick up what you eat as well. Like it does have effects. And it's like once you understand, how important this stuff is as well, so like even like you say, the cod liver oil or like the supplement, like, and going back even to kind of just getting some of those programs out of a kid's head that fat is bad. And, like you mentioned vitamin A before, and that's such a big point. I feel that today we have in modern medicine that we feel that vitamin A toxicity is such an issue that people have to be advised not to eat when it's pregnant. Well, after my first year, I actually went to test that in terms of both supplementation of vitamin A with cod liver oil, but also straight vitamin A supplementation. Both myself and partner had supplementation 50,000 IU of vitamin A since our second year. Had 5 kids, and then basically we were testing and one in the issues with pregnancies that there were 4 kids after. And any kind of issues with vitamin A toxicity, and there were none. Yeah, and so I think actually the pairing of vitamin D and vitamin A is a big thing. Is that we talk about K2 now a bit. You talk about pairing K2. You don't talk about pairing vitamin A.
Mm-hmm.
And pairing vitamin A with vitamin D is actually way more important than even the K2, because vitamin A is foundational to how a lot of the actual immune cells are formed. So vitamin D, for instance, picks up the immune system, and it also picks up the cells that create tooth and bone as well. Well, vitamin A is actually the nutrient that does that. And I think a lot of the issues that we have today is vitamin A deficiency, because it's an immune nutrient. It creates barriers. Mm-hmm. It creates bone. It creates vision and sight. So it actually helps us absorb. So one of the big issues that with natural production of vitamin D is you do need to absorb and read UV light through the vitamin A system. So if you're vitamin A deficient, your body doesn't pick up vitamin D as efficiently from the sun, whereas if you go out for 10 minutes, you should really absorb this stuff. So there's all these kind of nuances that we've just missed out. But once you work that into your household, it starts to become more normal, and the child grows up thinking that these things are actually good for them, instead of that kind of negative program that we were kind of brought up with. I think has a lot of harm.
Yeah, absolutely. I think it's all about how you spin it to your kids, and I think you have to live it too. It's really hard to tell your kid that they can't have a piece of chocolate chip cookie when you're eating the chocolate chip cookie, right? And if your house is full of chips and all this carbohydrates, you got to get that stuff out of your house. You got to get it out of there. And the vitamin A to me is really interesting, because so many people think that, like, beta carotene, for example, is vitamin A, right? If you pick up a supplement and it says vitamin A on it, it'll say like in the form of beta carotene. There's different kinds of vitamin A, and like what is your favorite type of vitamin A? If you're going to go for a supplement and you're not going to do the liver and all of that, what's your favorite kind in a supplement?
Yeah, well, so when I said, that's a good point. When I said vitamin A supplementation, so that was retinol supplementation.
Yeah.
So that was 50,000 of retinol. With fat-soluble vitamins, they all come in both inactive and active forms. And what's really important to realize is that if you're taking the inactive forms, that for humans, we don't convert these very well. And there's a lot of this stuff in supplements out there. When you're taking the inactive form, you do not get an effective dose, or your body just cannot utilize. With vitamin D, it's vitamin D3. So a lot of vitamin D fortification, for instance, in cereals, is vitamin D2. And that's taken from mushrooms, and your body has to convert that to D3, and actually competes with the metabolism of vitamin D3 in the body. So always check that your supplement is a vitamin D3 supplement, not a vitamin D2. For vitamin K, there's vitamin K1, and there's actually 2 types of vitamin K2, and MK7 and MK4. MK4 is the most active, and you probably want to try and take at least a half MK4 to MK7, because the MK7 is the is the fermented version of the vitamin K2, and that has to be converted to MK4 to be used in its more active form. So if you're picking out a vitamin K2 supplement, I would choose a mixed MK4 to MK7 type, and for vitamin A, I would pick a retinol supplement. So not a beta carotene, because beta carotene, you're going to have a very small percentage of that converted to its active form, and I would take between 25 to 50,000 IU, and that's all of these supplements are fat.
It's a lot of carrots. It's a lot of carrots.
That's a lot of carrots. Like you're going to go orange eating carrots.
You're going to be so orange to get to that amount of vitamin A that you need. Yeah. I remember just like in school, like vitamin A, carrots, there's so much vitamin A. And then when I learned about Weston Price, I'm like, oh my gosh, it's all beta carotene and it's not actually vitamin A, it's a conspiracy.
Yeah. Yeah, it's like beta carotene has its roles, but it's like it's tiny compared to what, and you can you'll get enough. It's very hard to be deficient for those kind of nutrients at all. If you have some kind of, whether it's, a pepper or a carrot or so forth in your diet, it's very hard to be deficient. Very easy to be deficient in retinol, yeah.
Yeah. And I think it's really interesting too, when I was pregnant with my daughter, like every single doctor appointment, it was like, are you taking a prenatal? Are you taking a prenatal vitamin? And I was like, no. And they were like horrified, like, what? And I'm like, I can tell you the supplements that I'm taking. And so, I followed the Weston Price protocol and it's interesting because, we push so much like the B vitamins during pregnancy and the folic acid, and we push, just like the prenatal vitamins, which have, your beta carotene in them mostly, but they're not, to me, when I looked at every single prenatal vitamin that I found, I couldn't find one that was sufficient enough in the amount that I needed being pregnant based off of Weston Price's recommendations. So when I put my list together, my list was like, eat 2 egg yolks a day. Okay, that's got my choline, right? And then it was like cod liver oil, that's A and D. Then it's like liver supplementation, that's your A. And we're taking like pretty big servings of these things, right, when you're growing a baby. But nowhere in the protocol is there, take this synthetic form of pill, right? The communities that Weston Price researched, they were eating just food, like real food. And that's how they were able to get all of their nutrients. And so I like that concept. I like that idea. I'm not perfect. So like, yeah, maybe I do need a supplement here or there. Like maybe if I don't eat 2 egg yolks a day, I need to take a choline supplement. But like there's no reason why we can't be getting a lot of these nutrients from our food or from supplements, right? Like I'm not going to sit down and eat a huge plate of liver. I actually grew up born and raised vegetarian. So I didn't have my first hamburger till I was 27. And actually finding Weston Price's research, kind of like for you, it was really life-changing. For me, I read that book and I was like, I have to eat meat and organs. Like I need to eat organs. So my first meat was actually heart. I went to the farmer's market and I'm like, I need the organ things. And they're like, here's some heartwurst. And I'm like, okay, I'm going to eat this. And I was so grossed out. It was disgusting, being a vegetarian. But I got over it, now I'm better. But yeah, I don't want to sit down and eat a whole plate of liver. So I have the freeze-dried liver in capsules. But I think that it's really important, we as a society, we have to be our own health advocates, and we have to know, like, what are the foods that we need to be eating to keep ourselves healthy, because you're not always going to find that at the doctor. Your doctor is going to tell you to stop eating the liver, and your doctor is going to tell you to take this prenatal vitamin with beta carotene, right? So I think that, like, what I love so much about your book, Dr. Lynn, is that you're really empowering people to take their health into their own hands and giving them the research and saying, like, no, this is truth, right? Because when you read things, they say, oh, vitamin D is bad and this is bad and liver's bad, but vitamin A overdose. But you have to know, like, the right questions to ask, right? Like, well, did you test it with vitamin K2 added? Or what kind of vitamin A were you testing? Was it a synthetic form of vitamin A, right? And these are the types of questions that not every person is going to ask. They're just going to read the article and say, oh my gosh, it's bad, it's scary, and I'm going to stay away from it. So
it's also I think it's a good example that, like, kind of gone into, there's a lot of devil to the detail with trying to think of how important, biological functional dentists are. Because if you've got a practitioner that's actually guiding you through this stuff, that's kind of like, hey, you probably need a supplement here, or, like, here's a dietary change, then it helps people along a big kind of rabbit warren of things that are difficult and sometimes hard to understand. and difficult to kind of, actually implement into life unless you really kind of dive into, all the literature and things like that. So I think it kind of really shows how pivotal that kind of, that functional biological dental office is, like that we spoke about right at the start. Like, if you've got someone guiding, if we have people guiding everyone through this, then it would really help a lot of people just kind of simplify their lives and simplify a lot of the health issues that can potentially come up.
Yeah, and just the doctors get on board too, because it's like, you go to your dentist. I've had a lot of people, they go, I tell them to do the things, and then they go to the doctor, and then their doctor scares them and says, oh my gosh, no, you shouldn't be taking that much. You shouldn't be taking that much of this, or that's not, you don't need to be taking that. And so then it makes people question, right? So I think that's also, I feel like there is so much room for us to improve and be all speaking the same language, because I think even the physicians, they're just doing what they're taught. They don't have a ton of nutrition education either, right? But if they see in a magazine that vitamin D is bad, then they're going to tell their patients that. So it's really tough.
Absolutely. That will take some time though. That's going to be.
I know. That would be amazing. That's my dream. So,
yeah, right.
And yeah, and it's really interesting because, like you were saying before, I think it's fascinating with Weston Price how, like, in just one generation of eating this more like processed food diet, that we saw physical changes in just one generation. It's like, I have patients ask me this all the time, and I really don't know how to answer it, but like, maybe you have a better answer. How many generations of really good, clean eating, nutrient dense eating does it take to get back to that original generation?
Yeah, that's a good question actually, and there's the Pottage's cat study I think provides a kind of good example for that. So this is kind of lends into the idea of epigenetics. So how our diet and our environment actually changes the way our genes respond. So in one generation, Price found that the subjects that he found, the levels of modern decay popped up, so 30% of decay, and malocclusion popped up. Now, in the Pottage's cat study, what the trial and the control groups were actually cats that were fed their raw meat diets, which cats are designed to eat, and also cats that were given a processed diet, basically, of kind of like basically what we would consider a processed diet today. And what he found that was in the first generation, they had the crooked teeth and the inflammation of gums. Second, third, and fourth generations basically got worse. So basically, they started to get their behavior started to change at second generation. By third generation, their fur was completely matted and they were smaller. They were unable to breed. And by the fourth, they died out. So once you eat 4 generations of this diet, the cats died out. And that's where I think we're kind of, if you think about Price, we're actually at 3 to 4.
Yeah.
And this is the reality. This is where our kids are. Our kids are born with airways they cannot breathe out of, and they are literally choking in their sleep. And so that to me is the third to fourth generation of those. These kids aren't going to make it, and like that's horrible to say, but it's like when we don't eat the right diet, it seems that our genetics can cope for about 3 generations, and then if you don't pick it back up, it's gone. Like it's gone, and like that's I think the reality where we're at, and all of the modern diseases are facing that way. You got type 2 diabetes popped up in the 80s. You got sleep apnea, which there's a billion people on the planet. That's choking in your sleep. That's diagnosed sleep apnea. So the numbers are far higher than that. But we've got a billion diagnosed people on the planet with sleep apnea, and then the next epidemic is Alzheimer's disease, where basically. They've got pediatric Alzheimer's disease now. They've already classified that, which is insane.
That is insane.
So that's absolute insanity. And that's the kind of the Pottage's cat picture where the third to fourth generation are just basically tapping out because they've got nothing left. Now, what Pottage did is he took those third generation cats and he tried to demonstrate how long it takes to get them back to the health of the original. It actually took them 4 generations.
Oh my gosh.
So 3 generations of harm took 4 generations to heal. So that shows the genes need more time to heal than they do to actually cause damage. So the damage will happen faster. In order to heal that damage, you have to get back 4 generations. So it tells us today we might be 4 generations. However, I think with a targeted healthcare system, and this is kind of an argument for things like supplementation and things like, for instance, if you take jaw growth modification. So if kids today are actually diagnosed early with airway and jaw issues and poor palatal development, tongue ties, like you mentioned, and we intervene in that, you can actually get a kid to 32 teeth adult development by the age 12 really simply. And that, I think, can help catch this up. So I think if we do proper intervention, proper dietary intervention, I think supplementation, mentioned prenatal supplementation. Yeah, prenatal supplementation is awful. It's absolutely awful. That the dosages and the types of nutrients they put in, if we fixed that and we fixed like nutrition and we fixed how we're intervening in the baby's growth and development, it's like I think you'd actually have a maybe 1 to 2 generational, but you've got to do it, pretty targeted and well in order for it to happen. I think with just food, if everyone started to eat perfect, like kind of natural, kind of, organ-based, nose to tail kind of food for, as long as they could, they'd probably take 4 generations. If we had a healthcare system that was targeted on changing this and we had a whole process to get the next generation up and going, I think probably 2, maybe 1 to 2 generations. But it's going to take a lot to do that. So it's a really interesting question, actually, and it kind of shows how potentially urgent the picture is.
Yeah. And I mean, just to add on to that list, I mean, infertility is huge now.
Yes.
I mean, we're already seeing like that we are not able to like repopulate without the help of Western medicine, It's sad.
Yeah, which is something that people don't talk about, but it's like really, really seriously bad. It's like we're past the replacement levels for our population, and the infertility levels are rising. And if they say it's 2030, it's probably getting up higher now, and seems to be rising, quicker and quicker. But that's a huge problem that needs to be fixed quickly, or it's literally there's no solution. It's over.
Yeah, definitely. And I mean, I think if we just always are turning to Western medicine for the next best drug or the next best thing, everything has got some kind of consequence. Everything has got a side effect, right? And we don't always know what the side effect is going to be until people have been on it for a long time.
And actually, just on the replacement, Dr. Taylor, I think it's 2.1 kids that everyone has to have to be at replacement level. So everyone has to have 2.1 kids.
Oh my gosh.
At least. Right?
2.1. Okay. We'll work on that.
Right?
Yeah. Okay. Well, this has been so awesome. So, Dr. Lin, you mentioned that you are in clinical practice, but you're not in clinical practice anymore. Is that right?
For the moment, not. Yeah.
Okay. So what's your next, are you going to write another book? What is your next?
Yeah, I'm actually writing another book at the moment. So I'm in the first stage of writing another book that will kind of, talk a little bit more. This one's about fluoride and about the kind of the effects and how to kind of, so
that's going to be good.
One, but I've avoided talking about it, but I mean, it's kind of, I think it's time to start to kind of, people need to know about it as well. It does tie into a lot of things we're talking about as well. Mm-hmm. But because of certain reasons, dentists have been kind of a little bit tired from talking about it. But so, I'm going through the process of writing that book. Yeah.
Awesome. That's so great. And then for anybody that's listening, so Dr. Lin's book, you can buy it on Amazon. You can buy it online. It's called The Dental Diet. And you are also pretty active on social media, correct?
Yeah, so they can follow it at drstephenlin.com. And so the kind of general tips on a lot of parenting stuff, but just some kind of general health things and a little bit different to kind of just the functional dental stuff. We try to go into some different areas, hopefully get into some movement things as well, and talk a lot about kind of tongue posture and myofunctional principles as well.
Mm-hmm. It's all so linked together. Once you go down that rabbit hole, it's so deep.
You can't unsee it. Yeah,
you can't unsee it. I know you can't unsee it, and it just gets deeper and deeper and deeper. I know I've been on this journey for 11 years, and it's I finally kind of feel like I have a grasp on it, but it's just ever changing too. So it's fun. It keeps my job very interesting.
Well, it is. Yeah, it is ever changing. Even the fluoride, it is literally changing, and it's changing quite quickly, which is exciting. But there's a lot going on, so it's important to kind of keep finger on the pulse.
Yeah, awesome. Okay, we'll make sure that we link your book in the notes for our listeners. And if you enjoyed the episode, make sure you subscribe to Your Mouth Matters so you never miss an episode. If you found this conversation helpful, share it with your friends, leave us a review, and let us know your biggest takeaway. Thanks for tuning in, everyone. And until next time, remember, your mouth matters.